Are you looking for a space where you will learn to improve your mental strength, emotional health, and heal your insecurities from the inside out? Take the first step to living a more meaningful life with the Better Me with Body by Bree podcast. I'm your host, Bree. I'm a certified personal trainer, entrepreneur, and mother of four. I've helped empower thousands of women to take action through fitness, nutrition, meditation, and mental development, and aligning thoughts with action. This podcast is for those who are ready to feel inspired and motivated to live a more purposeful life. Let's grow together.
If you've ever wondered whether breast implants mean you have to stop lifting, or if you've heard horror stories about implant illness and you don't know what's fact versus fear, or maybe you've questioned whether your core will ever feel the same again after pregnancy, this episode is for you. Today, we're cutting through the noise around plastic surgery and fitness with one of the most respected names in modern aesthetics, Dr. Jerry Chidester. He is a board-certified plastic surgeon, national educator, and co-founder of the Plastics Clinic Plus Spa and in High Point Surgery Center in Draper, Utah. He trains surgeons around the world in advanced breast preservation techniques and is known for doing things very differently in the best way. In this conversation, we unpack the biggest myths that women believe about implants and working out, what implant illness actually is and isn't, whether you really need to avoid chest training, how to know when ab separation crosses the line into tummy tuck territory, and the biggest mistake women make when returning to exercise after implants or a mommy makeover. We also dive into the newest techniques and trends every woman should know before making decisions about her body. This is a honest, empowering, no-fear conversation designed to help you make informed choices without sacrificing your strength, your confidence, or your long-term health. Let's dive in.
Hi, Dr. Chitty. Welcome to the podcast. We are so excited to have you. I know you're so busy, so I'm grateful that you're here taking the time to talk with us.
Thanks, Bree. It's so good to see you again. I can't believe it's been several years, I think, since I was last on here with you. So it's crazy to see how often you've done, and it's good to be back.
Same. I know. Last time we talked, you were not just starting out, but you had just kind of come on the scene in social media. And now looking at what you've built is so inspiring and incredibly motivating. I would love to kind of hear what you're up to before we dive into all these topics about lifting and implants and everything that's new in the implant world. What have you been up to? What is new with you?
Okay, we're going to summarize about 4 or 5 years in maybe 15 seconds. So yeah, since we last spoke, I had originally started my practice in 2020, just the 7 of us, small practice. I was using social media to really try to gain a following, but more so just to educate people on things like breast implants and plastic surgery, how cool it can be. And we just blew up, utilizing all these outlets, I think giving good, consistent results. We grew. I ended up hiring on several other surgeons over the last several years. So we have 4 surgeons now. We just hired 4 more. So we have 8 surgeons coming this summer. We're opening 2 locations, one in northern Utah, Davis County, and then one in southern Utah in St. George. And we rebranded as the Plastics Clinic back in 2021. And we've opened a med spa. We have a whole wellness, functional medicine, fitness, nutrition component to what we do. Because really what we're seeing is plastic surgery is not just about the surgery. It's really about how you treat your body inside and out. And we really want to help people in that journey. And so it's just been fun over the last few years to just see all that happen. And the goals we have ahead are just really, really exciting. So anyway, that's why it keeps me busy.
Oh my goodness. Well, I love following you. I love seeing your new facility. It's beautiful and all the things you do there. It's amazing what you're doing. And I'm just really excited for you. So let's dive into our podcast. So today's episode is for every woman who has implants or is considering implants, or maybe wants the mommy makeover, or maybe feels too scared to lift heavy because she doesn't want to mess up the implants that she has. A lot of the questions that I get in my DMs are either around like, how do you work out with implants and how do you make sure that you don't mess them up? Because there is so much misinformation online. So I wanted to bring a true expert on here so that we can separate fear from facts. So, first, Dr. Chitty, my first question is, what do you think are the most common fears that you hear from women when it comes to lifting weights after getting implants?
Yeah, the most common fear is this going to mess up my results, right? Because I think it's about, we see more and more women just wanting to be super fit and take care of themselves. And, the traditional way of putting implants in the breast to give women volume was underneath the breast, the pec muscle, right? So we call it under the muscle, or you hear maybe half under the muscle or dual plane. These are all different ways that surgeons, since about 2000, early 2000s, started doing this. And the reason we started doing that back in 2000 was because in the 2000s, we only had access to saline implants. We didn't have silicone implants off the market for over 10 years because the FDA said, hey, the companies need to research, making sure it's safe to have silicone in your body before we let you bring it back in. So it was only saline back then. And saline bags above the muscle up to that time did not look good. Above the muscle, saline just looked like water bags, and they didn't feel or look natural. So in the early 2000s, there was a surgeon that said, hey, let's try putting them under the muscle, make it more natural in the upper breast pole. So that's where that trend started, was in the early 2000s. And even the subfascial or above the muscle approach was presented around that same time in Brazil. But really the under the muscle took off in the US. But because of that, you can imagine when you have a big, bulky, voluminous implant underneath your pec muscle, you're trying to do bench presses or anything upper body, it physically can pull the implant. And so surgeons over the years have tried to find ways around that to affect your activity. But there's still a lot of surgeons, including myself. I say, look, if you go under the muscle, you have to be super careful. It could alter your results. And the reason why is if you're doing bench press, as the pec contracts, the implant goes perpendicular to the muscle contraction. So that's why you see a lot of women with them down, out in their armpits, separated the cleavage lines. And so they're really worried about that. And so that's probably the main concern I hear about women with exercise when they're under the muscle. And that will be, we can
Mhm.
talk about it, but it's totally different when we now look at the newer technologies we have with newer breast implants, internal bra, and going above the muscle.
Yeah, I'm seeing people start going above the muscle, and when I got my implants, I feel like it wasn't really big to go above the muscle, like you said, because you could see the rippling and it didn't look very good. But I'm seeing a lot of your patients loving going above the muscle because they can lift heavier and it's not affecting their. So, would you suggest if you are a lifter to go above the muscle? What is your suggestion?
Yeah, so there's kind of two camps, right? There's a lot of surgeons that still say under the muscle is the best technique. I mean, they're used to that, and that's how I trained as well, right? And so that's what I learned. But more and more, as I've looked at, when women come in, I listen to their concerns, and they say these things like, hey, I love to work out, I love to be fit. And I think in the era of, GLP-1s and nutrition and fitness, people really want to avoid changing their anatomy structurally, right? And be able to lift as much as they want. So there's kind of two camps. I've kind of shifted almost completely towards protecting your muscle at all costs, right? And I think we can do that nowadays, even since we last spoke, because there's just better technology in the United States we didn't have even a year and a half ago, right? So, for
Mhm.
example, the latest breast implants with Natrel, Mentor, Sientra, those are the three FDA approved brands that have silicone implants in the US. They do have more gummy gels, and those more gummy gels or more cohesive gels hold their shape a lot better. And when they hold their shape better, if you go above the muscle, it's less likely to see rippling. And that was one of the main concerns: is above the muscle, it ripples, it doesn't look good, right? And so with these newer gels, they hold their shape, they look more natural and can feel more natural. But now with the sixth generation implants, Motiva, who has now come to the United States since last year, I guess 2014, 2024, over a year, they even have more advanced technology in terms of, they call it monoblock technology, 100% filled with gel. The shell surface is a little different to help protect, you. And so the look of it above the muscle is very natural and can avoid rippling as well. And then you add things like an internal bra for some people who need that support. And now we're able to add lower pole support without them dropping, with them being above the muscle. So these are new technologies we don't have. And now, more recently, if you see, I talk a lot about it now, it's called breast preservation or even preserve. So Motiva has a toolkit and a technique that certain plastic surgeons can do in the country. And I'm training and teaching more and more people along with other trainers in the country. But this technique actually now, if it's your first time augmentation, we only have to make a small incision in your skin. You can do this surgery awake in the operating room with a little bit of sedation, maybe none. And we can do all the surgery inside the breast without any incisions. And so now there's no dissection, there's no tissue damage. We preserve the nerves, we preserve the arteries, preserve the muscle, preserve the fascia, preserve the breast tissue. And now your recovery is quicker, you're having less pain. And so there's all these benefits that we're seeing. And I've been doing Preserve for around 6 months now, and we're just seeing phenomenal results. So I just love where it's going for women in terms of being able to be active and having implants.
Yeah. And so that procedure is over the muscle.
Yeah. We call it above the muscle or prepectoral. Yeah.
So how do you prevent, I know you said that you can do the internal bra. Is that something that people need to worry about, is having them drop because they don't have the support of the pec? Or if you do the internal bra, we don't need to worry about them dropping?
That's an awesome question, actually, because the thought is that if it's under the pec muscle and the capsule that forms around the implant kind of hold on, right? Kind of latch on. They kind of stick together up high. That's why sometimes under the muscle you kind of see the implant sitting high. When you detach the muscle, I do a lot of women where they're under the muscle and they just hate how they feel and move and they're active. So we actually convert it. We call it to above the muscle. And so we fix the muscle, we reinsert it, and then we add an internal bra. So I personally, in my practice, believe that if you're going to switch that from under to above, you do need support, because I do worry about skin stretch, and really depends on the implant size. The bigger the implant, the more support you're probably going to need. But that's regardless, because even if you're under the muscle and you have a heavy implant, you're going to have that same issue. We see that same issue. So it's not like, I wouldn't say muscle is magical in keeping it high, but I think it's much more likely to either hold it high or pull it out, right? And so not every person needs to be above the muscle, but definitely not everybody needs to be under the muscle, And so I think now there's just more options. There's more tools. We can do whatever we need. In Preserve, there's no internal bra needed, because the breast ligament, we call it the circummammary ligament, that's truly kind of the secret sauce behind this concept of breast preservation, is we can place an implant within the ring of the breast, this ligament, this very strong ligament. That's what creates the roundness of your breast shape. And so when we put the implant in that space, it supports it. And so you really don't need an internal bra. But in the end, it's going to be up to the surgeon and the patient, kind of what their needs are, what function they want, and then the surgeon's experience and tool set, and saying, hey, you know what, like, you may not be a good Preserve candidate because your tissue might be too thin. Let's do an internal bra support. Or we may say, hey, let's go into the muscle, right? So now we just have all the tools available to us. And it's super cool because now a patient can really choose.
Yeah, you have options. And I love that you're always trying to look for what the newest science is. Sometimes you find surgeons and they just stick with what they know and that's it. And you're always trying to find, like, okay, is there a better way, more efficient way? That's really cool. I think that's probably why you're so successful, for sure.
Well, thank you.
That's amazing.
I'll be honest, I don't even do the same breast augmentation today that I did a month ago. I've literally have changed it more. And it's not that I'm experimenting. I don't do that. I'm never experiment on patients, right? But it's taking techniques and principles and slowly applying them. I mean, I've been in practice now for almost 8 years. And yeah, it's changed a lot, right? Even since we last spoke. But I do it very slowly. I don't want to do anything that would be, either unsafe or whatever for the patient. But in the end, yeah, I've evolved, and I think I've gotten to the point where we could, again, create minimal to no damage to breast tissue, add the proper support so that you can have, a good look that you want, but also have all the function you need and have the least amount of downtime. And I think we're very, very close to just having that augmentation.
That's amazing. That is so exciting. I wanted to ask you about mommy makeovers, but before I do, let's talk to the women who do have implants that are under the muscle, that are lifting and working out, and they are nervous about them pulling into their armpits. Do they need to avoid chest day or pull-ups? Like, are there certain movements that will pull them into their armpits that they need to avoid?
Yeah, I mean, I would say yes. Now, everyone's anatomy is a little different, right? The way your chest, your sternum is shaped, your chest, the way your muscles insert, how big of implants you have, how much muscle was dissected by your surgeon. So first off, if you ever have questions, you should talk to your surgeon and ask them, because their technique is going to be different than mine, than any other surgeon, right? And so everyone's a little different. And some patients, because of their anatomy, regardless of the technique, their implants don't move. If they're doing pull-ups, push-ups, they don't move. And some patients is because of surgeon's technique, sometimes all the above. So definitely talk to your surgeon. But in general, most surgeons would tell their patients, if you have underneath the muscle, like dual plane implants, probably first off, probably avoid any of those things like pull-ups,
Mm-hmm.
bench pressing and all that. Or they say you can try it after you're fully healed, maybe at 3 or 6 months post-surgery, see how it feels. And if you start feeling pulling and weird things, definitely wear a supportive bra, but it could over time stretch out your lateral pocket. And I see that a lot now. I have so many active women coming in
Mm-hmm.
and they're like, why are my implants over here on the side of my armpits? Their cleavage is like 4 or 5 fingers. And
Mm-hmm.
I'll take the implants and I'll hold them up for them underneath the pec muscle. And I say, flex your pecs. And then they just go like this instantly as soon as they flex. So you can see, we call that animation. And animation, you can call it animation deformity or animation, what's happening, meaning it's just moving the implants. And, we saw this in breast reconstruction. So well before cosmetic surgery, breast reconstruction, because women's breast tissue is completely removed, with breast cancer surgery. And so we would have to hide the implants under the muscle when we used to do this. But now we don't do that for women with breast cancer because it's so deforming. Women with breast reconstruction and they move, you can see the implants moving. They call it severe animation. And so that's why even in breast reconstruction, we've gone to going above the muscle, even with no breast tissue. So when we talk about rippling and thinness, well, yeah, we've been doing this for a while in breast reconstruction for women. We fat graft. There's other things we can do to thicken the tissue, but really want to avoid just that movement. And so we see this when people work out. And so you just got to be really, really careful. I definitely say talk to your surgeon about that.
Yeah, you can definitely tell in bodybuilders, like when you see bodybuilding competition, they're always out by their armpits. That always scared me. So when I got my implants, I didn't do a lot of direct chest work because
Mm,
I can feel it pulling. I can see it pulling.
yeah.
And I'm not going to lie, it was really hard for me because I could do like 15 strict pull-ups before
Oh,
I got my implants. And now I can barely do one because it's so
yeah.
uncomfortable to do that pull-up movement. And for me, I'm like, okay, well, it's not worth it to mess up my implants.
Yeah.
So I just had to take it out altogether. So I love the advice to listen to your body, see how it feels. Every doctor does a different technique. But yeah, don't push it. If you feel it pulling into your armpits, that's your sign. It's probably going to continue to pull if you continue to do those movements.
I agree. Yeah, don't push through it. It's going to alter. Now, if you're okay with it altering your results, but honestly, 2 or 3 times a week, I'm working on women and we're doing surgery to repair the muscle and put it above the muscle. This is a very common
Mm,
surgery we do now. And obviously, we have to assess the patient, make sure it's the right thing to do. But you mentioned something. You said it just didn't feel right. It just felt weird. And that's
mm-hmm.
something I hear so commonly when it's under the muscle. And the first thing I hear when someone is recovered from the surgery where we converted above the muscle is it feels so natural, you know, and they forget they have implants and now they can just do whatever they want. And I've told women, look, if I have to reinsert or sew back in your muscle, I can't guarantee your function is going to come back. But I've had many, many patients now come back and say they're able to do all those things again, like you mentioned, like pull-ups, push-ups. And so again, it's going to vary by patient. It's really going to vary by how their muscle was originally dissected by the surgeon and if we can fix it. But I think you can get a natural feel and have normal function and a look. It's still possible, even if you have implants currently that you're having those problems.
That's awesome. Well, when I do my next implant, maybe I'll go over the muscle.
Yeah, it
So,
might be an option for you.
yeah, I did have another question that came into my mind when you were talking about the silicone. So, have they approved silicone? Is it safe? Does it leak? Do you ever worry about breast plant illness? Like, what do we need to know about the silicone versus the saline?
I love it. So first off, when it comes to silicone, in terms of medical grade silicone, the breast implants are the most studied medical device in the history of man, right? Like, because when the FDA took them off originally, I mean, they've been around since the 50s, 60s, and they have gone through several generations, we call it, right? Like, kind of like the iPhone, there's different generations of iPhone, there's new things that come out, new features. But now we're to the 5th and 6th generation of implants. And, the quality of these implants, you hear the term gummy. I mean, really that relates to a safety thing because gummy means that the silicone inside these implants is a cohesive gel. The way that it's put together, this gel it's not supposed to come apart, right? And then these implants have several layers and the shell itself is an elastomer shell. It's made of silicone, but it's at least 5 or 6 layers thick. They make multiple layers of this. And one of the key layers is called a barrier layer. So the barrier layer is really important to help prevent any silicone migration across the layer. Because even though you have the layers, there's these forces that can create silicone movement across, right? You hear about gel bleed and things, but that's what the barrier is for. And if you look at Motiva, the 6th generation, they built their implant from the ground up. They said, hey, let's take all of these technologies, let's make the safest implant for women as possible. And so their barrier layer, they have a high quality control. If you look at a Motiva implant compared to other implants, they look a little bit different. That's because they have a quality control shell, so that you can tell if there's ever a leak in the barrier or a hole in that shell layer. They won't ever distribute that implant because they don't want it to cause issues. So with that being said, I would say these newer implants are focused really on women's health. Even the shell design for Motiva, they call it a smooth silk surface. So as we know, silk in the body, silk is made by spiders and things. It's an inert substance, meaning the body doesn't react to silk. Your body doesn't try to like get rid of it, right? It doesn't try to break it down or attack it. And so the surface of this Motiva implant is very similar. The way they've designed it as a body just doesn't really latch on. Now, 5th generation shells do the same thing, very similar at least. But all these implants are aimed at decreasing the immune response in the body. So I tell women, look, at the end of the day, they're very safe. The studies show they're safe. The studies on implant illness, there's a lot of really good scientific data now that's out there that Dr. McGuire and some other plastic surgeons have studied in women. And, at the end of the day, though, I tell women, if you don't want an implant, for one, you don't want a foreign body, that's fine. Like, there's no forcing that. If we can use your own fat and your own tissue, great, we can do that, right? But there just has to be an expectation of what the look is in a fat grafted breast versus an implant. They're just very different looks. Fat is very, very natural, doesn't have much shape, right? Implant has a shape to it. So we just have to know that there's different options. But yes, I would say they're very safe. I mean, the Motiva 6th generation implants are wonderful. 5th generation is great. But in the end, it's going to be up to you. And I tell women, look, if they do make you sick or we think you're sick, we want to work that up. We want to make sure that if you're going to take out your implants, we really know if that's the cause. Because, half the time, looking at these studies, half the time women take them out, they don't feel better. So it's something else happening, right? So that's the important thing. I think there's a lot of really good information out there. There's a lot of misinformation out there. So really it's making sure you're fully informed, see a board certified plastic surgeon, get all the information, and then you can decide, do you want saline, you want silicone, you want fat graft, or nothing, right? And that's the beauty of the options we have today.
So does the silk, because I remember they were recalling the textured implants because they were causing capsular contraction. So does the silk help limit that because there's not as much friction?
Yeah, just to clarify, so the Motiva calls their shell smooth silk. It's actually not made of silk, but it acts like silk in the body, meaning the body doesn't attach. So it is a silicone shell, so it's not made of silk for Motiva, and the other ones are all silicone. But yeah, the whole point of that is just to say that, the body has a less chance of responding and making capsular contracture. So we see that if you look at the FDA published data from the 5-year Motiva study that they had to do before getting approved in the US, their capsular contracture rates are extremely low. And that's the sign that, the body is just not attacking the implant. Now, the surface of this, the FDA, there's 3 different types. There's like a smooth surface, textured surface, like you mentioned. And then Motiva is approved as the 3rd. It's called smooth silk surface because it's not a textured, it's not a smooth. It actually acts like smooth in a lot of ways, meaning there's never been a case of lymphoma associated, a primary case of lymphoma with, so we call it ALCL. You may have heard of implant-associated lymphoma. That's with the macro-textured implants that, were either recalled in the US or a lot of surgeons, I don't use those textured implants. So Motiva acts like a smooth implant. There's never been a secondary ALCL case with smooth or with Motiva in the world, with over 3 million, 4 million implants of Motiva. So I think they're safe from that standpoint, right? But then they more act like, I would say, they also don't make a thick shell. So like textured implants make a thicker capsule. That's why they stick, because it's almost like Velcro. Motiva doesn't do that. Motiva, again, acts more like a smooth. It doesn't create that shell. So there's kind of the 3 different shell types in the US, and that's what we currently have approved.
Okay, great. I had another question for you. What trends are you noticing coming up in the future? Like, I notice you're doing a lot smaller implants. You're doing more moderate implants. I'm noticing you do more moderate than high profile. Like, what are some trends that you're seeing happening?
Yeah, no, you hit it right on the head. So I looked back at all of my implants, like, because I always look back at my own data and look at the cases I do. We do research on it to see, okay, how can we get better, right? It's like everything we do, like when you're fitness and working out, you want to know, what your PR is, you want to get better, right? So, with this, I look back to my data, and my average implant size has gone down over 50 cc's. So on average, women are doing 50
Wow.
cc's less. And I would say it's even probably more so this year. And I think with the advent of Preservé, like I was talking about earlier with Motiva, where we're not having to make incisions, now women are just wanting very small natural breasts because there's no downtime,
Mhm.
not affecting their function, and they just want a smaller, perkier breast, right? And so even the upper
Mhm.
fullness is more of a natural fullness, more of a teardrop. But I still see both, right? We still see people that want in the 400 cc's, but truly like that really, really large implant, it's just much less common than I used to see even in the early 2020s, And so it's cool to see that shift. I do think less weight on their breast is good, honestly,
Mhm.
just because all the gravity and the weight of more volume is just more unpredictable. And that's why I think internal bra was great. It can help at least, but it really, in the end, it can't overcome the weight of like an 800 cc implant. It's just not that strong. So it's nice to see
Right.
that shift. I would say there's also a shift in terms of trends, right? To again, above the muscle. Whether that's a trend or not, I personally don't think it's a trend. I think it's a functional benefit and an aesthetic benefit for
Mhm.
women. But I think more and more surgeons are feeling more comfortable with the technology we have to do that and go above the muscle. I train surgeons on those techniques, or how to give talks about it. So I think more and more people are accepting it and seeing it's a really good technique and long term can give good results. And so that's just really exciting to me. And then even adding fat grafting and off the shelf fat for cleavage lines, that's another, I don't know if it's trend, but it's an up and coming thing, right? So alloclay
Mhm.
is something where it's actually it's cadaver fat, but it's not even fat cells. It's tissue from humans who have passed that is processed. All the DNA is removed. It's more structural tissue. It's not really fat graft. But then we inject that. It looks like fat, and then your body ingrows to it and creates volume. So your body doesn't create fat out of it, but it creates volume. So in women who are very thin in the cleavage lines, you can get a really nice, pretty appearance.
That's amazing. Well, and I notice a lot of women, have you noticed that women are wanting more moderate profile versus high profile, or is that the same?
Yeah, I would definitely. So I looked at my data, and for example, Motiva, they have three profiles. They have a mini profile, which is like a moderate. The demi profile is like a moderate plus, and then the high profile or full profile. And most of my implants now are going to be demi, which is a mod plus, or a mini, moderate, more so than I did with full profile in the past, or even extra full.
And
I don't do many extra fulls anymore.
for women that are listening, that is like how wide they go versus out, right? So they know the
Yeah,
difference.
yeah. So yeah, exactly. So a moderate profile implant has a wider base and less projection, or like less straight let out of the chest, right? And so that means just less roundness overall, more natural, we would say. On the other end of the spectrum, a high profile, it's more narrow based and a lot taller coming off the chest. So it's a lot rounder to make that dimension work. So that's, I tell patients, like, if you're on the low profile and to moderate, that's gonna be a more natural look, and then on the high, extra high is going to be more of an augmented look. And then we,
Got
inspirational
it.
photos are super helpful because we can get an idea of kind of the look and the lines that you're wanting, and we match that with your body. We can do now 3D imaging. We do, chrysalics, where we can actually show you what it will look like. It's actually
Oh,
relatively
cool.
accurate. So there's just, yeah, a lot of really cool things we can do. Simulate having a lift with it at the same time, adding fat graft. We can do all this stuff with 3D software. It's really cool.
Wow, that's amazing. I did see that, well, just saw that you did Taylor Frankie Paul's um
Yeah.
augmentation, and they look so good. They look so natural. They fit her body so well. And on her tiny frame and how thin she is, it's really impressive that you got natural cleavage. Like, that was really impressive because that's hard to do. If you can't tell, I love this world.
Oh, it's awesome. Well,
I'm just
she's
impressed.
yeah, I've posted about it. She's allowed me to post, so I can share a little bit. But yeah, I mean, she was originally under the muscle when I did hers several years ago, before all the stuff that TV and everything. Well, she was under the muscle, implant, and then she was having a little bit of issues on one side where she had some stretch. So we converted her. So everything we talked about, we did that. We fixed her muscle, added some lower pole support with internal bra, and then we did a little bit different implant. We did the Motiva, and then we did the alloclay. So that's how we're able to get more cleavage naturally, is when the muscle's not constraining us. Because some people's anatomy, their muscles insert very far, very wide on the sternum. So if you're underneath that, you'll never get closer, right? So you can add fat graft to
Mm-hmm.
kind of blend that, but really the implant just stays far. When you go above the
Mm-hmm.
muscle, we can go wherever we want. Actually, you have to be careful. You don't want to go too close, right? And create a uniboob. So we
Yeah.
preserve the cleavage, but then we can add volume like aloe clay, for example, and give you a really natural look. It's very smooth and blended.
I noticed it was very good. Good work, Dr. Chitty.
Thank you.
Okay, I want to kind of shift a little bit into mommy makeovers because a lot of my clients and listeners are at the age where they're done having their kids and now they're looking to possibly do a mommy makeover, but they love to work out. So I asked, what questions do you have for Dr. Chitty? I probably got over 150 questions that
Wow.
came in. They were
Let's
so
answer them all.
excited. I know they were so excited. So I kind of just condensed some of them. I've already asked a lot of the questions that they have asked, but I want to know for women that are considering a mommy makeover, what do you wish that they understood before surgery if fitness is really important to them?
Oh, that's a great question. So first off, a mommy makeover is just one part of the journey, right? And to me, if you think of mommy makeover, what does that typically entail? Because you can customize a mommy makeover. I call it mommy takeover because you're taking your body back. So I call it takeover. But in a mommy takeover, the surgery is just one aspect of everything you're wanting to have done, right? So you had your kids. Physically, your muscles are separated, and that's probably the biggest component is a tummy tuck for most women because you get that diastasis recti, right? Your muscles are gapped. And there's a lot of exercising and things you can do to help strengthen your core. But sometimes it's so gapped, you're never going to restore those muscles together. There's no exercise that can physically fuse those back together, right? And so I think the most powerful aspect of a mommy takeover is the tummy tuck. And a lot of times women have a hernia with that because after pregnancy, at the belly button, you can get a little hernia where, stuff's poking through. And that can be uncomfortable for women. But the tummy tuck, we remove extra skin, we put the muscles back together, and almost like every single woman I've ever talked to, like immediately their core just feels more stable. A lot of times their lower back pain is gone, because you're kind of compensating, right? When your core is
Mhm.
loose like that and you're trying to engage your muscles, you're using your back, you're kind of relying on those countering muscles on the back to support you as you're trying to lift and do things. But when you can offload that by putting the muscles back together, now you can really strengthen your core. So many women after mommy take over a tummy tuck just see their definition come back. They can get, new records. And you hear all these cool things like women like, hey, I no longer pee myself when I like do a jumping jack or when I laugh or sneeze, right? So that gets better. Lower back pain, like I mentioned. Some women have said their bowels, like a lot of times they have bowel problems, just, constipation, diarrhea, that goes away, right? And all this stuff makes sense because it's really restoring your core function in your abdomen and it allows you to do exercises you couldn't do before. But I tell women it's a journey, right? And so it's really important to be as prepared as you can prior to the surgery. So the surgery is kind of like the last step, right? It's like, and
Mhm.
for some women it's not, but for many it's like if you can get to your goal weight and where you want to be fitness wise, then have your surgery, your results will be even that much better, right? And so
Mhm.
everyone's on a different journey, like I mentioned, but that's the coolest thing is seeing women have that after surgery and the confidence that comes back is like mind blowing to me. And I love that part of my job.
Yeah, that's exciting. I think it's cool when if they have like a goal, like okay,
Mhm.
this is my goal to get where I want to be after having kids and then I can when I hit my goal, I can see the benefit of all of my hard work and sew the abs back together and get rid of the excess skin. So I'm
Mhm.
totally I'm all for women helping themselves feel more confident and working hard for that. Um I did have a question with diastasis recti because I'm helping evaluate the diastasis recti all the time with my clients. And I do tell them there is a point where exercise cannot heal this.
Mhm.
So
Mhm.
how do you determine, yeah, this needs to be surgically healed, or actually you could heal this with, physical therapy and the diastasis recti exercises?
Yeah, because no, it's great. I love that because again, it's a combination, right, of things. It's like doing the exercise, doing the therapy you can to get to where you need to get. But what I tell women is, we always examine your diastasis in clinic, right? And if you have functional issues, first off, potentially like all these things we just talked about, that may be one indication we should consider it. And so that doesn't matter. I mean, you could have a two-finger diastasis, you could have a four-finger, and some women have a four-finger, they have no issues, right? So then it becomes an aesthetic problem. So is it either a functional issue for that woman, meaning they can't do what they want to do regardless of how wide the diastasis is? Or is it an aesthetic problem? Is it meaning like they feel like they look pregnant still after it, right? Or is it still bulging? Or
Mhm.
maybe they got loose skin. So there's two sides to a tummy tuck, which I think is super fascinating. But in the end, I tell women, look, if any of those things bother you, it would maybe make sense to get a tummy tuck. Now, I don't just align, like if you measured a diastasis, like if you got a CT scan or an imaging and you looked and you saw the muscle gap was 3 centimeters, right? Okay, that's one thing. It's stretched 3 centimeters. You can exercise and do things to strengthen your rectus muscles to maybe compensate for that. But that 3 centimeters is never going to come back together. There's no exercise that can do this, right? The muscle will get stronger and
Mhm.
compensate, but it won't do this. Now, if because they're gapped and they have looseness and laxity, then we actually oversew. We actually, instead of just putting it back together, we actually oversew that so that it actually really flattens your core and restores the core strength. Because I do believe your muscles can get stretched out even from pregnancy, right? You think about it, like they're sitting on top. They're these strap muscles that get stretched from pregnancy. So they're not the normal length they used to be or the distance. So even though the diastasis may appear to be close, the muscles themselves have either been stretched or there's too loose. And so really my goal with a muscle repair isn't just to get the edges together, it's to get your contour and the tightness back that you had before kids. And so sometimes where I'm
Mhm.
correcting 10 centimeters in a woman when really their gap was only maybe 3 centimeters, that's just because they're so loose, right? So that to me is what matters
Mm.
more than just that physical diastasis.
Do you ever not suggest a tummy tuck for a woman? Is there ever a red flag or like you're not a good candidate?
Yeah, so there's going to be two things. That's the skin. So what's happening with the skin on the surface? Because sometimes women have, well, most women that get tummy tucks have looseness above the belly button, right? So below the breast down to the belly button, that's the upper abdomen. That skin is loose from pregnancy many times. And then from the belly button down to the pubic bone, that lower abdominal skin is loose. So if there's no laxity or looseness in any of those, then I tell them, look, now, I mean, we can fix your diastasis if you're having functional problems, but aesthetically, your skin's fine, right? And so
Mhm.
that may not be a time to do it unless they're like, hey, I actually functionally want this repair. So that's more of a functional surgery in that point.
Mhm.
And then, yeah, sometimes if the diastasis isn't significant, even if they've had children and the aesthetic is just a little bit of loose skin or whatnot, we can do what's called a paniculectomy where we just take out skin if that's the problem, leave the muscles. And I've done that. Or we do liposuction, right, and skin tightening. But in the end, all these things are all on a spectrum, and you just have to see a plastic surgeon to really
Mhm.
figure out what's like the best for what you want functionally and aesthetically.
Yeah. Is there a way to get rid of excess skin underneath your belly button without removing your belly button and keeping your belly button?
Yeah, I mean, there's like hybrid mini tummy tucks. I used to do mini tummy tucks, and I think there are some women who are candidates for that. But really, it's a very, very small fraction of women. I think a lot of them are like, hey, can I fit in
Mm,
that category? And it's like, probably not. Or if you do, it's not going to look
got
very
it.
good because the belly buttons, it really depends on the position of your belly button naturally on your abdomen, depends on how long your torso is, depends on how much skin laxity. All these things, like they have to be perfect to be able to do all that without it looking creepy. I've just seen some,
Mhm.
surgeons like they float the belly button, meaning they cut underneath, right? They cut the base of the belly button, so there's no scar on the outside. But then they pull the skin down, the belly button gets pulled down with it, and then they reattach the belly button. Now my belly button's sitting so low, and you look like a kind of alien
Mm.
because it's like, why is my belly button down by my
Yeah.
pubic bone, right? It's just very weird. So it's just such a small amount of women, I think, who are good candidates for a mini tummy tuck, honestly.
Got it. That's really good to hear and know because I get that
Yeah.
question a lot from my friends. Like, I wish I could do a tummy tuck, but keep my belly button.
And we keep
um,
it. So like when we do a regular tummy tuck, we cut around it, right? If you look at like my results and other surgeons, like you can hide the scar. So the whole point of
yeah.
that is like make it look as natural and hidden as possible, but give you the function and aesthetic you want, right? So you can definitely make it
Mhm.
look really nice and unnoticeable. My favorite thing is like when I see some of my patients, like they're like dancing online and you can see their belly button and there's not a single comment that says, did you get a tummy tuck? That's how you know you did a good job because no one's like pointing it out. It looks natural enough. They can't see
Yeah.
the scar, you know?
Definitely. Definitely. Yeah. The worst is when you can tell because
Yeah,
then you're
yeah,
like, well,
yeah. We
shoot.
don't want you to tell. Yeah.
Yeah. Okay. So, what does a realistic timeline look like for women who are returning to lifting after they get a tummy tuck or a mommy makeover?
Yeah, it's definitely a graduated thing. I just tell women in the first 2 weeks, I mean, you should be up and walking, right? So the important thing is walking. That mobilizes swelling, fluid, helps prevent blood clots, get your circulation flowing, helps you to heal. So those are all important things in the first 2 weeks, but we don't want you doing any lifting more than 10 pounds, especially with your core, because we put the muscles back together with suture, but it does take around 3 months for that to really kind of fuse back together. So what I tell women is the first 2 weeks, kind of walk around, light treadmill stuff. From weeks 2 to 6 is when you can start doing maybe lighter exercising, but not really focusing on your core. Maybe you're doing light upper body stuff. Maybe you're doing a little bit of light jogging on the treadmill, maybe some stationary bike stuff, right? But then when you get to 6 weeks, you can start activating your core more. Now you're kind of getting that to heal together. You can do light things, but I still wouldn't do like sit-ups and just really aggressive core workouts until probably 10 to 12 weeks. Once you're at that 10 to 12 mark, I mean, you can just do whatever you want. You might feel some tenderness and pulling, but you're really not going to tear that apart. That repair has now kind of fused and scarred back together, and it's strong enough where it's not going to come apart.
Got it. Okay. And then what mistakes do you see women make when they rush back too fast?
Well, yeah. So in the mommy takeover, we're talking breasts a lot of times, tummy, liposuction, labiaplasty, right? So the mistakes they make too fast is just doing too much weight and doing too much in the beginning. Because I know so many women are just like, they want to get at it, right? It's like they love that and they're so good at it. And so it's so hard to have that downtime, even if it's for 2 weeks for some people, right? And it can be very emotionally and mentally challenging for women. And so, we try to find creative ways that are tailored to each woman, that they can do things that like helps them. But I think, the biggest mistake is just probably lifting too much, too heavy, too soon. And that can cause either things like bleeding or fluid collections or other things. Scars going to be thicker, right? Because there's tension on scars. And if you're standing straight too quickly, because we have to pull you tight for the tummy tuck, your scar is going to be thick. And so these are all things that we want you to have great results. So if we can just preserve it for those first key few weeks to get through all that, you're going to have beautiful results. Then you can do whatever you want.
Okay. One more question. What is the most dangerous myth that you see on social media about implants and working out?
Well, one of the myths I hear is about like getting in a sauna after working out and it's like leaching. That's not true. That is like categorically not true. There's people just
wait, what's the myth? What is that one?
They say that like silicone implants will leach or leak through your body if you get in a sauna. And it's just the weird. It's just not true at all. There's some people online spreading this. Is not true. I mean, these are baked. Literally, the implants, the way that they're made to cross-link the silicone, they're baked at extremely high temperatures. I actually threw one in an oven for Thanksgiving. I put it in a turkey to experiment and show people. Like, we had that thing at 400 something degrees. I mean, so that before that implant even starts to degrade, because they don't melt. Silicone does not melt and doesn't freeze. But before it starts to degrade, I mean, your body's going to be charred. So it's really not going to affect it. So that's probably the biggest thing I hear that's just not true. And then, when it comes to implants in general, again, I think, I don't think bigger is better nowadays. And so you hear that all the time, that phrase, like, oh, just go bigger, and okay, bigger is okay if it's like 20, 30 cc's. Maybe we need that to fill your cleavage a little bit. But we're talking like, oh, I need to go 100, 150 cc's more. Or the surgeon's like, hey, I went bigger just because I thought it looked better. Like, that's just not going to do you well in the long run, right? So I think really honing in on like the look you want. We have tools now. We have 3D imaging. We have sizing. We have all these different ways to really get you a really good look without like oversizing you.
Yeah, I think that is so cool that you have all of that technology, because before I remember when I was trying to get mine, and this was like years ago when I wanted to do it after my second baby, and they're like, "Okay, take this bag, stick it in your in your shirt." I'm like, "How is this? It's like over my current, like there's no way you could even tell." And they're like, "Now look in the mirror. What do you think?" I'm like, "I don't know." So I'm so glad that you have that. I'm like so jealous they didn't have that back in the day. That's really cool. I forgot to ask, how often do women need to replace them? Is there a timeline?
Yeah. First off, the FDA, there's no like rule. Okay. So the FDA says there's no rule, but the FDA does want women to know that they're not permanent devices. So first off, at some point in your life, you're going to have to take them out. Just like any other medical device, like a pacemaker, a knee joint replacement, all of those devices are not permanent, right? They're not meant to be. But breast implants, typically on average now with the 5th and 6th generation gels, there's no strict guideline. But what I'd recommend is typically what the FDA says. So after 5 or 6 years of having your implants, you should either get an MRI or an ultrasound to check the integrity. We can do that in our office. A lot of surgeons have an ultrasound. We can look, we can see if the shell's intact. If it looks good, you can keep that implant. You can just keep rolling with it. And then every few years after that, check it. So I would say on average, you're probably like 15, probably more years now. We used to say 10 years, and that 10 year was just kind of arbitrary. That 10-year number came from old data that suggested that after 10 years of a silicone or saline breast implant, every year after that it was in your body, you had a higher and higher chance of it spontaneously rupturing. But now we look
Mm-hmm.
and, we just see implants these days, they're just so much more durable. That's just not really the case. And so the most important thing is just surveying your implants. And if anything ever changes or feels weird, let your surgeon know. We can ultrasound it or look at it.
Do they need to replace them if they're getting capsular contracture?
Yeah, I mean, if you feel like your breast is getting hard or it's uncomfortable, we're actually in a clinical trial right now with a company that's looking at how to treat capsular contractures. So if anybody wants information on that, you can reach out to me. If you have capsular contracture, I can get you more information. But yeah, if you're starting to have that scar tissue buildup, and let's say you've had implants for 15, 18 years, I mean, those were the older implants, right? And so it's possible that you would need that exchanged. It's probably not the end of the world, but you probably want to get that taken care of sooner than later, just because it's uncomfortable, probably doesn't look normal.
Mm-hmm.
And when we take it out, we're going to replace it anyway. So yeah, probably
So
if you're not liking it, see someone. Sorry.
So it doesn't mean that their body will immediately like reject the implant again if they have it. Maybe if they get a different implant, their body will react differently.
Yeah, how we understand capsular contracture in general, we do think it relates to some kind of, I wouldn't say bacterial contamination, but something that has to do, and we have bacteria in all of our body, right? But something that kind
Mm-hmm.
of seeds that pocket, that implant, and then the body kind of creates this response, almost like, I kind of imagine like keloid scarring, when someone gets an ear piercing and then they just get this massive scar. There's some process that happens in particular people for whatever reason that they just build a thick scar. And that can happen later down the road too, right? If that implant ruptures. So yeah, capsular contracture, we try to understand it. But when we take that tissue out and we put a fresh implant in, there is a chance that you're higher to get that to happen again than someone who's never had capsular contracture. We know that. So when you
Got
have
it.
capsular contracture, that's why we're doing this study right now with this company, is because they say, hey, we actually have potentially a solution, right? But anyway, so there are different ways that we go about treating that. And it's not sometimes just swapping the implant, right? It's like taking out the capsule, doing other things to try and prevent that from happening.
Got it. Okay, this is so helpful. I'm hoping that our listeners are feeling like maybe they are in a consult with you, and I'm asking all the questions that they submitted that they were curious about. So, to close, my last question for you is, if there's one thing that you want women to walk away with, it's this. What would the one thing be that would be helpful for women who work out, who are considering implants, or maybe who have implants, that would be helpful for them?
Yeah, the one thing I would consider is there are so many options. And if you're afraid, if you don't have implants and you're thinking about getting them, I think you're in your prime position right now to really get a good consult and have amazing results with just the latest technology that is new. I don't even say it's new, it's been around 15 years, but it really is something that we have now in the US that we didn't have before, that gives you more options, right? To have the look and the feel and the function that you want. And when it comes to mommy takeover stuff, I would say, you've sacrificed your body for all those years raising your kids. You literally sacrifice your body to bring children into the world and then raise them, right? And so I know women are the most selfless people, especially moms, right? And so you're the last person you want to take care of. You want to take care of your kids and everyone else first. But in the end, you got to take care of yourself too. And whether that's with plastic surgery or not, that nothing to do with that. It's taking care of yourself. And that can be your mental, your emotional state, and your physical state. And that's why I think exercise is so important, and your nutrition. And then if it makes sense that plastic surgery or getting your body back is in there, great. Like I said, that's kind of the icing on the cake, but that happens after you've done all those other things. So take care of yourself. It's not a selfish thing. You totally deserve that for yourself.
I love that message. No shame. I
No
love that.
shame.
Well, I'm so grateful that you're here, that you shared so much information with us. I'm scared to ask this question, but if someone wants to work with you, don't you have like a 2-year waiting list? Like, what do we tell our listeners? How do they get in with you? Or your
Yeah, they can.
team. I know you have a team now,
I
right?
do. Yeah, I have me. I have, like I said, 3 other surgeons currently. We have 4 more coming. We have a phenomenal team. Our whole goal at the plastics clinic has tried to become like we all give the same experience, right? And our results, we try to give the top-notch results as well. My partners, they make amazing belly buttons. They do great work. I've trained them all in the Preserve technique, so they do that. We're very similar in how we think. I'm more than happy to see you. If it's for breast augmentation surgery, I can get you in sooner than 2 years. The wait for mommy's makeover is like 6 years right now, actually. So, but for breast stuff,
6
yeah,
years?
yeah. I don't want
That's
to say 6,
insane.
7, but yeah, it's about 6 years. Um,
Oh my gosh.
yeah, but my partners, they all do, like, we literally like do so many mommy makeovers is what we do, right? So you can come see my partners.
Mhm.
If it's breast only, those are a lot shorter surgery, like an hour. So I can get those patients in a lot quicker. So you can DM me on Instagram or you can contact my office, and I'm happy to give you information on me or my partners. But no, I appreciate Bree for having me on. You're phenomenal. I think what you do is amazing. And I love, just everything about you. And I've always just loved following about your stuff. So thank you again for having me on.
Oh, thank you, Dr. Chitty. I appreciate that. I want everybody to know how to follow you and so your clinic is called The Plastics. If they want to follow you, what's your handle?
Yeah, so our handle for Instagram is the Plastics Clinic, and then mine's just Dr. Chiddy, Chiddy. That's on Instagram, TikTok, YouTube, and I guess Facebook. I don't know. I don't use Facebook as much, but yeah, no, I appreciate that. And uh,
Yeah, you need to follow Dr. Chitty. He's hilarious. And I love okay. There was one reel that you just did, and I was dying. It was so funny. She walked out of the room and she
oh,
had like, she
yeah,
didn't have anything on, you guys. She was topless and she had her little pasty things on, but she was so confident walking down. And your nurse was chasing her with the gown, and she's like, "No, I'm good. I don't need it." That was genius. That was so
well,
funny.
that's actually a true story. So like that obviously was staged, and we protected
Yeah,
the
yeah.
hall. We literally had all of our staff because, well, actually, first off, there's no one in clinic that day. It was like on a Friday or something,
Mhm.
whatever. And so we had the staff that block the hall on both sides, so nobody could come. But that patient, she had we had taken her photos in the photo room, and she just started walking out. We're like, yo, you got to put your gown on. She's like, I don't care. I'm like, well, yeah, but there's like other people out there. She's like, no, I really don't. She's like, I'm so happy, And so I was
Oh,
like,
that's
well, let's
amazing.
do a TikTok. So obviously we had to stage it. But no, she literally did. And we hear that all the time. I mean, women come out, they're like, hey, we got to go take photos of you in the photo room. And they'll just walk out and they have their robe on, but they just have it open. I'm like, hey, you got to
They're
cover up.
excited.
Yeah, no, they're so happy. And we're not trying to like, make that into a thing, but really it's the confidence, right? You mentioned it's the confidence. And
Mhm.
that's just the coolest part of our jobs, I think.
Yeah, if you don't follow Dr. Chitty, go follow him. I love the information you give. I can tell that you genuinely care about women. You care about the long term of how they're going to feel. You're very technology driven and forward in research and science, and you educate us. And I really appreciate that. So thank you for being a wealth of knowledge. Go follow him, share the episode. If you have any follow up questions, you can always comment below or DM Dr. Chitty directly. Okay. Thank you,
Thank you,
Dr. Chitty.
Bree.
Have such a great day.
You too.
Bye.
Thank you. Bye.
Thank you for joining us in today's episode. If you liked the content and want to hear more, remember to hit that subscribe button and write a review. As a small business owner, I appreciate it more than you know. If you are looking for a program to help with self-confidence, to lose weight, get in shape, and work on your mental, physical, and emotional health, check out my training programs on www.bodybybree.com. My team and I help to hold you accountable through the Body by Bree app, where you log in to see all your workouts, custom meal plan made specifically for you and your needs, and communication through the messenger. You are never alone when you're on the Body by Bree training program. Click the link in the show notes to get more information on how to transform your life from the inside out.